Our study raises very serious questions whether a man should even use the PSA test for prostate cancer screening anymore. Professor Stamey also said that he had also come to believe that PSA test was not a useful predictor for the amount or severity of prostate cancer. And it's also raised in benign conditions. So the tough part is people are using blood tests to guide their care. So in the old days, in fact, this fellow here, Dr. Stamey, he's the guy that discovered PSA might be associated with cancer. He concluded the worst prostate cancers and the highest PSA, the exact opposite are true. So 20 years ago, and this would upset me, is if you've had a prostate problem or prostate removal and it was done in the old days, here's the guy that discovered it, says, I removed a couple hundred prostates, I wish I hadn't. And again, this is out of the Journal of the National Cancer Institute, 2002. So they're doing things that based on a blood test that's not accurate. Okay, now let's look at how the body is. So now let's say that you've got blood being produced, and it's not just blood, it's white cells, all the different constituents. But what happens is, and this right here, this big structure here is the liver, this one coming across is the pancreas, and this cool organ over here that's about the size of a fist is called the spleen. Now what the spleen does, okay, and this is why I started with the Ben Stein movie, Intelligent Design. Tell me if this isn't intelligent. This is really cool. The spleen, every 20 minutes, 6 million red blood cells go through it. It checks each one for viability. Those red blood cells that it thinks can't hold enough oxygen or aren't viable enough, what it does is it sends those red blood cells over to the liver. The liver takes the used up red blood cells, breaks it down to the protein constituents, uses the enzymes, and builds a substance called bile. And what he uses with bile is it stores and concentrates the bile in the gallbladder, so as soon as fats hit the duodenum, which is a part of the stomach, or is part of the intestinal tract right outside of the stomach, as soon as fats hits there, the gallbladder contracts, you break down the fats. Breaking down the fats means that you produce appropriate hormones. So this means you're protected from cancer by the hormones that are made there. You produce glucocorticosteroids, mineralocorticosteroids, sex hormones. I mean, it's amazing. So that process is vital. Does that make sense? Yeah. I know, random chance? I don't think so. So
does that go on continuously during the day or just once at night?
Constantly. In fact, every 20 minutes it's checking the red blood cells. So you're talking 6 million cells. Every 20 minutes it circulates through. Okay, and that's just flat out amazing. Now let's look at what goes in the blood, because remember, nutrients, medications, they're all inside of the blood. How does it get there? So when you take that food in, now let's say you take in a coconut, or let's say you take in a Tylenol, or a diuretic, or a piece of celery. It doesn't matter. Whatever you take in your mouth has got to go into the intestinal tract and it gets broken down. And depending on the charge of it, whether it's a positive charged ion or negative charged ion or how it's broken down, it's going to travel through this and it's going to get absorbed into the bloodstream directly. So you have raw food constituents inside of the blood. And this is also where some of the problems come in. Now let's say that you take an antibiotic. Okay, then let's say you take a wideband antibiotic. Now the way the antibiotics are supposed to be prescribed in Europe, it makes sense. In fact, if you look at the label of all antibiotics, it says first you got to do a culture. That means you got to spit in a cup, you got to have some type of sample, and they got to grow it. Okay, so you got to grow a sample of some type of mucus or something. That takes 24 hours. Then, if you find a bug, you got to put it in an incubator and do what's called a sensitivity test. You got to find the actual specific antibiotic that's going to kill this one part of bacteria, because antibiotics don't work against viruses or funguses, and a lot of them don't work against bacteria. So it's called a sensitivity test. Now, anybody know how much it costs to do a culture and a sensitivity test? It's about $15. Okay, now considering cancers are associated with antibiotics, is it worth $15 to find out if you got a bacterial infection? Yes or yes?
Yes.
Yeah, it's worth $15. Okay. Now here's this. They studied over 3,000 patients. They say that high antibiotic use is associated with non-Hodgkin's lymphoma. That's a blood cancer. It also says that using non-steroidal anti-inflammatories, this is ibuprofen, Motrin, Advil, Tylenol, those are also associated with non-Hodgkin's lymphoma. That's a blood cancer. So should this be utilized extremely sparingly and scared? Because anything you put in your system gets in the bloodstream. Do we know the mechanism of how the non-steroidal anti-inflammatory drugs cause cancer? No. We don't. Do we know how the antibiotics cause cancer? No, we don't. We just know they're a very, very dangerous drug. And when you're learning language, anti means against, bio means life. I guess they don't really, I know, antibiotic is against life. Okay, so now here, daily aspirin. Now this is tough because people are looking at aspirin has a vitamin. And now remember, anything you put in your mouth gets in the bloodstream. But it doesn't get in the bloodstream in the exact same concentration in every area. So now here, a lot of people are taking it because they want to have decreased cardiovascular events, which is like heart attacks or decreased blood clotting, so decreased strokes. The problem is a lot of the studies now are saying there's no difference in incidence of cardiovascular events irrespective of aspirin use. However, since aspirin inhibits blood clotting, there's a huge rise in GI complications. That means your intestinal tract starts to break down. So, yes?
What about the Celebrex? I saw the Celebrex.
This was a study in comparing people taking Celebrex and aspirin and people taking non-steroidal anti-inflammatories and aspirin. So it was a weird study because some of the researchers now, they're looking at aspirin, a daily aspirin a day. You know, Bayer paid over $1 million in fines saying that that was healthy for you. What was interesting in the study, it compared Celebrex and aspirin or non-steroidal anti-inflammatories and aspirin. What they didn't do is compare vegetable juice or water and cardiovascular events. Can you see the skewed thinking here? It's a little bit backwards. And beside from which, so anything, and I know I'm bringing this up again, but when you eat something, now let's say you eat a coconut. That bolus of coconut gets in the intestinal tract and it literally filters in through this intestine. And then this intestine gets in the vein. And the vein goes up into the liver and it gets diffused over. So you have this bolus of either an aspirin or this bolus of celery or this bolus of a cheeseburger gets in that bloodstream and it goes through. So since it's in this area, is it everywhere in your body at the exact same time, or is there different concentrations of that nutrient?
Yes.
Okay, good. So, and I know this is a tough concept, but when you start looking at it, it's not just that bolus of food that gets pushed around through that's in a different concentration. It's also the medications. Have you heard of a thing called an antacid?
Yeah.
Okay, now, is that specific only for the stomach?
No.
No. That antacid, there's no drug that's organ specific. It goes in the intestinal tract, into the liver, into the spleen, into the entire body, up into the brain, across the blood-brain barrier. A lot of medications do that. Some do, some don't. We're not quite sure. Then it hits the brain, the spleen, the kidney. So we're not quite sure at all the effects of all of the medications. Now, this is the scary stuff. We're doing things called food products now. Now, have you heard of high fructose corn syrup?
Yes.
50 years ago, you wouldn't have. Okay? In fact, 40 years ago, you wouldn't have. Now it's in over 6,000 different products. It's the #1 source of calories. Have you heard of homogenized milk?
Yeah.
Okay, what happens when you actually break up the fats in the homogenization process? It takes a healthy milk product, which would be like raw milk, and it actually creates shards of fat. So all of this stuff, the packaged products like the heart disease spread, the colon cancer drug, the acrylamide chips, these are the trans fatty acids. They're all the different oils and fats that are for shelf life. Now this gets put inside of this area here.